right. Well, I will start us off. Firstly, I'd like to welcome all of you to our webinar, Residency Real Talk with Dr. Desai. We're super excited to have you all here tonight. I know that we're waiting for a couple more people to join here, so we'll give them a little bit of time. But in the meantime, I'll introduce myself and the team. So I know that I've probably talked to many of you. My name is Alyssa Harlow, and I am the Director of Marketing here at MD2B Connect. Also, part of our team is Ryan Downey, who just joined just now. He is on our VP for Residency Admission Services. And then we also have the co-founder, who is Manish Sabnis, who I'm sure many of you have talked to. And then we also have Dan Morris, who is our Director of Client Services. Great guy. We love Dan. And at the top of the pyramid is the great and wonderful Dr. Desai. So that is our whole team. I just wanted to say that while we're doing the webinar tonight, if you guys have any questions, please feel free to put them in the chat, and we will try to cover them and answer them throughout the entire webinar. So without further ado, I will pass it over to Dr. Desai.
Great. Thank you so much, Alyssa. I want to welcome all of our attendees. All of you are either rotating or have rotated with us. And I wanted to thank you so much for being part of our MD2B Connect family. It's something that you've heard us talk about before, but it's something that really comes from very deep within our heart. And we thank you so much. And we consider it an honor and privilege to have you as part of our MD2B Connect family. So we're very excited today to do this webinar. It's an opportunity for all of us to come together, for us to share some very, very important information as we get closer and closer to submitting our residency application. And we are going to be covering two very important topics today. The first is on program signaling, and that is an important part of the ERAS supplemental application. I know you have heard about it, so we're going to go into a lot of detail, much more depth about program signaling and how to use it to increase your chances of success in the residency match. And then we are also going to be talking about publishing. I know a lot of you have been thinking about how to publish, how to move your projects forward so that you can get them completed and also strengthen your application and get them into your publication section. But we're going to be talking about a different way to publish, the type of work that perhaps you haven't been thinking about, but is also very accessible to you. So we're excited to share that with you, and that's going to be in the latter part of our webinar. That's something that Ryan and I will discuss with you. So that's a little bit of a surprise, so something to look forward to. Now, I want to remind everybody that as part of our resources that we have a lot. And so as rotators, you all get copies of our books, The Successful Match and Success on the Wards. Those are two resources that I encourage you to really dig through deeply, because there's a lot of information in there, and it will really help you become an informed residency candidate. And with that knowledge, you'll be able to make good decisions moving forward, and also strengthen your residency application and attract the interest of those programs where you would like to receive interview invitations. Success on the Wards is a book that a lot of US medical schools use to help students transition into their third year of medical school, to make the most of their learning opportunities and to make a great impression on the attendings and the residents with whom they work. We have received a lot of feedback from international medical graduates on this resource and how it's helped elevate their performance during rotations, whether it's with us or with universities or hospitals or other academic settings where you will be rotating. So please do take a look at Success on the Wards. It's an eye-opening look into how to meet and actually exceed the expectations of those with whom you are working with, and that will help you earn stronger letters of recommendation. Now, the two books are not the only resources that we have. We have a lot of material on our website. So you all are very familiar with md2bconnect.com, where we actually have a section on IMG-friendly programs, which will help you as you try to make important decisions of where you're going to apply. But we also have another website called thesuccessfulmatch.com, which is chock full of other information, everything from important blog posts on how to create a winning personal statement to ARAS application guidance to Q&As with program directors. So there's a lot of information there. On both websites, you can also access our podcasts. So please do take a look at that. This is where we go deeper into a particular topic related to the residency application cycle and the residency match. So I wanted to remind you of those resources. And now what we're going to do is dive deep into those two topics that I mentioned, starting with program signaling. So I'm going to take control of the screen and show you some slides. Okay. Okay, can everybody see my slide? Alyssa, do you see that?
Yeah, we can see it.
Okay, perfect. So let's go right into programming signaling. So let's start with what program signaling is all about. And one thing we know from a lot of research in residency selection is that your interest in a residency program matters a lot. And you can see the evidence of that if you go to the NRMP website and you take a look at the document NRMP Program Director Survey. You can go back to archived documents. They produce these every 2 years, and you will see a criteria that they ask program directors. They ask them, how important is this applicant's perceived interest in your program in the interview decision-making process? And you will find that it's a highly rated criteria. A large percentage of programs look at that. And of course, there's different ways to express interest in a residency program, but program signaling is a relatively new way to do it, and it's been proven to be a very, very powerful technique. Now, it is part of the ARAS supplemental application. So there's 3 parts to the ARAS supplemental application. There are the meaningful experiences, there are the geographic preferences, and finally the program signaling. Out of those 3, programming signaling, there is evidence to suggest that that is the most important. So that's why we're talking about this today, so you can have a good plan moving forward to signal those programs where you hope to get interviews. Now, how does it help you? Well, it allows you to show the programs that you have that deep interest, and it allows you to stand out from the competition, from those applicants who don't signal that program. And what is it that the programs receive on their end? Well, they will receive a list of deeply interested candidates, and that will allow them to more easily factor in the candidate's interest level into their interview decision-making process. So as I said, program signaling is part of the ARAS supplemental application. Now, why do we have program signaling? And the reason we have it is because we have had an epidemic of applications, increasing number of applications year after year that are being submitted to residency programs. Every year, residency programs set new records for the number of applications received. To give you some perspective, when I went through the residency selection process in the mid-90s, I applied to internal medicine and I applied to 12 programs. Now that might shock you, but that was not unusual back then. Of course, it is very unusual now, and even US medical students apply to 50, 60, 70 programs, and of course, IMGs apply to many, many more. Now, because of the pandemic and the fact that interviews have gone virtual, programs have seen an even sharper rise in the number of applications that they have received over the last few years, largely because virtual interviewing makes it easier for people to attend more interviews than they have ever before, because you see in the past, the travel would limit how many interviews you could go to. So now, because of the increasing number of applications that programs receive, it presents a very significant challenge to programs. Programs are trying to determine who is truly interested in their program. And when they have large volumes of applications, as they have become accustomed to receiving, This is very taxing for the program. There's only so much manpower in a program that is available to review these applications. And because of this, that is the major reason why the emphasis on step scores has increased so much over the years. And that has been a problem in so many different ways. And as I mentioned, the other reason that preference signaling is being used is because the sharp increase related to the COVID pandemic. So what they're trying to do with program signaling is to see those people who are truly interested. Because if you think about it from a program's perspective, if you get 2,000 applications and you can only interview 300 or 400 people, they want to invite people who are sincerely and truly interested in their program, because those applicants will, of course, rank those programs and they are more likely to be able to fill their class. So just like applicants are worried about not matching, programs are also worried about that as well. So that's why program signaling is used in the residency selection process. Now, one of my colleagues who's a program director at Georgetown in the Department of Otolaryngology puts it very well. And she says, we hope signaling will encourage a more holistic review of applications. In the past, because of sheer numbers, programs have used objective measures that don't necessarily correlate with resident performance. We are looking at scores and honor society memberships and numbers of publications. These aren't the right metrics. So there is a strong movement underway to encourage programs, to facilitate programs doing a more holistic review of applications where everything is being considered and there isn't this undue emphasis on step scores. And program signaling is a way to achieve that. Now, which specialties are participating in program signaling? So let's take you back to the history of program signaling. So that started as a pilot program in the otolaryngology residency match during the 2020-2021 cycle. And then after that, other specialties came on board. So in the 2021-2022 application cycle, urology came on board and developed its own preference signaling program as part of the American Urological Association. And then in the last cycle, the NRMP match incorporated preference signaling, but only for 3 specialties. And those were internal medicine, general surgery, and dermatology. Now this year, things have changed considerably. So now you can see on this slide, all the specialties that are participating in signaling as part of the NRMP match. So you can see the specialties listed in the slide, and the number in the parentheses to the right of each specialty is the number of signals that you can send to programs in that specialty. So for example, if you are applying to neurology, you can let 3 programs know of your deep, deep interest. So it can be as few as 2 signals or as many as 30 signals in the specialty of orthopedic surgery. So now we have this year 16 specialties that are participating in program signaling, which gives you an idea of how successful program signaling was in the last cycle with respect to those 3 programs that participated in the inaugural year. So how is program signaling used by programs? So this, of course, as you would expect, depends on the program. So each program defines or decides how they're going to use signals to aid them in their decision making, either for inviting applicants for interview or for creation of the rank list. Now, we would hope that programs would be incredibly transparent, would tell us exactly how they're using it, but very few programs are doing that. That's largely because it's new and the programs haven't exactly figured out everything yet. I think they're in the process of figuring it out. But the exact way each individual program is using it is not going to be clear in most cases. Now, it is very clear from the data that we have that some programs will use it as part of the initial application review. So when you submit your ARAS application, they will also take a look at your supplemental, all 3 parts of the supplemental, but of course the program signaling to help make their decisions on whether to extend an interview invitation. Now, if they have similar applicants, people with profiles that are roughly the same, they could use program signaling as a tiebreaker. So for that individual who has expressed that deep interest in that program versus someone who hasn't, that nod may go to the person who's expressed that interest. Some programs might make it a requirement for interview. So if they don't receive a signal, it could mean that they're not going to consider that candidate for an interview. And then some programs are using it for the development of their rank order list. But let's dive deeper. So that was a nice general guidance on how programs are using it, but let's look at the data. So we actually do have data about how program signaling was used by programs in the last cycle. And we have data for internal medicine, general surgery, and dermatology. But I'm only going to use internal medicine here. And if you're interested in doing a deeper dive into this data, all of this is available to you at the AAMC website. So you can access this and look at it in much greater detail. So what were the notable points from the data that was collected on how program signaling was perceived? Well, in internal medicine, it turned out that 89% of programs used these signals during the application process. Now, we should keep in mind that not all internal medicine programs participated in this survey. So it was about 90 programs. So that's obviously well short of the 500 or so internal medicine programs that are out there. Now, 67% rated these signals as either important or very important for use as a screening tool before they actually conduct a review of the application. So again, we talked earlier about the large number of applications these programs receive, and they have to have some system in place to make that large application volume a much smaller number that will undergo a more closer view. So they can use program signaling as a screening tool. 35% of programs indicated that signals were important or very important in sending interview invitations to every applicant that selected the program. So that gives you some evidence that there are some programs that see that signal and use that signal to make a decision on the interview invitation. What else did we learn from the survey? Again, staying with internal medicine, we found out that 66% of programs indicated that signals were important or very important for use as part of a holistic process to help decide who to interview. And again, as I said before, we are trying to move towards a more holistic process, and the signals were being used as part of that process. 61% indicated that signals were important or very important for use as a tiebreaker when deciding whom to interview. And finally, I want to share this last statistic with you, and that is 82% of the respondents agreed or strongly agreed with the following statement. And that statement is, preference signals helped me identify applicants whom I would have otherwise overlooked. I want you to process that statement for a minute. That is a high percentage, 82% agreed with that statement. So this is what signaling is all about, is those programs that you have an interest in, that you think you're a good fit for, that you would like to be there, that you would like to get that interview. This will help you not be overlooked. And that is a big, big current problem in the sea of applications these programs receive. So let's go over some important dates. So with respect to the ARAS supplemental application, not all programs are participating in program signaling, but those that will participate in it will be released and published on the website, the AAMC website and the ARAS website, in early July. So that's something you want to look for. It's just a few weeks away, so you want to know exactly what programs are participating in this. And then the supplemental application actually opens on August 1st. And then you have some weeks to complete it. And you have until September 16th, because that's when the supplemental ARAS application closes at 5 p.m. So keep these dates in mind and remember to try to use this time that we have starting from now all the way to September 16th, to your advantage to make sure you make great decisions regarding the programs that you want to signal. So what are the approaches you can take to signal programs? So this is a very individual decision. There's a lot that just comes down to what do you prefer. So let's go over some possible approaches. So the first approach that we can talk about is that you only signal programs that we would say are safety programs. And how do we define safety? Those are the programs where you think you would have less difficulty of getting into. So when you take a look at your profile and you take a look at your STEP scores and your US clinical experience and your letters of recommendation and your year of graduation, you have a particular profile. So you may find that there are certain programs where you think your profile would fit very well. Now, you can also factor into that decision fit. You might be looking for programs with a certain mission, maybe certain goals, and maybe your mission, goals, the things you've done fit very well with those programs. So those would be programs that you might consider your safety programs. Now, the second approach is to signal programs that are your reach programs. Okay, these are what we would call, some people would call your dream programs, where you feel you would have more difficulty getting into. And the hope would be that by signaling your interest, that would make them take a closer look at your application. And then if you have done a compelling job with your ARS application, your personal statement, your letters, your US clinical experience, that would give you a leg up, so to speak, on getting that interview offer. A third approach would be to do a combination of dream and more attainable or safety programs. And that's, again, just a mix and match of the two types of programs. And then approach number 4 is to not really factor any of those things at all, but just signal programs that you're truly and mostly interested in based on what you want to do with your career, how it aligns with the program's mission, and so on and so forth. Now, my colleague says that signals, this is her philosophy, signals should be used to reach out to programs where students are competitive and have a chance of matching. You want those programs to look at your application. And there's a lot to be said for this approach, because remember, matching is enhanced, right? Increased. Your chances of matching are increased as you receive more and more interviews. So if you signal programs where you think you're competitive, that's going to help you net more interviews, and that's going to increase your chances of matching. And you can see that on the NRMP data, again, looking at the charting outcomes of the match and seeing the number of interviews. And as people get more interviews, the match rates of those people with increasing numbers of interviews. And you can see for different specialties that differs. And so getting to that number, which really sharply increases your chances of success, is what we're all trying to do. So again, think very deeply about how you want to approach program signaling. Now, some additional tips for program signaling. First of all, I recommend sending program signals. You don't have to send them, but I highly recommend sending them because of the data that I just presented. And I can tell you some great stories of students who applied last year that benefited from program signals. Now, it does mean that you have to be strategic. So everything we've been talking to this point is about being strategic with where you send your signals. And that involves being realistic about your qualifications, being realistic about your application strength, and talking to people who are in the know. So if you're working with someone who has a lot of experience in residency selection, somebody who's a seasoned faculty member or mentor, don't be afraid to talk about program signaling with those who have that type of experience. Now, to make the most of this opportunity to signal programs, you want to research programs well in advance because you want to make good decisions on where to send your signals. You only have a limited number at your disposal, so you want to use them wisely. So what do I recommend that you do? Well, first, I recommend that you visit the program's website so you can understand what their philosophy and their practices are with respect to program signaling. Now, as I said earlier, there are many programs that are not particularly transparent about how they use signals, but some programs are. And since this is a rapidly changing area, it's really important to visit those program websites to see exactly what they say. And then you can use that in your decision making. Now, we saw last year that some people use multiple signals for the same program. So if you have 5 signals to give, there is no advantage to signaling the same program 2 or 3 times. It won't increase your chances of getting an interview there. And in fact, it hurts you because you can't signal other programs. And yet that was something that we saw not uncommonly last year. Now, if you have done a clinical experience at a program, this could be your home institution, or you did an away elective, an observership, you may not need to signal that program. Now, that depends largely on the specialty you're applying to. So each specialty has been releasing position statements on how signaling should occur, and that is based on consensus from their programs. And so some specialties will say that in these cases or these circumstances, you don't have to signal because you've already expressed a deep interest in the program by taking the opportunity to rotate there or spend time there in some fashion. Now, another thing to really factor in terms of your strategy is to consider whether you have friends, contacts, colleagues, people in your network at these programs that are accepting program signals, because it can be very useful to talk to your friends about how the program sees program signals. Because if it's not a requirement, it may not be necessary for you to signal that program because your friend or your colleague or your associate or your network, they may be signaling the program on your behalf. So in that way, you can reach a larger number of signals than you can do with just the program signals itself. So that is going to be something that you're going to have to individualize in conversations with your friends, with your seniors, to decide whether you want to use your signals at places where you have some connections. Because we've all heard stories, and this is very, very true, that residents, faculty, people with connections to the program, if you know those people, they can advocate for you at those programs, and that advocacy in the past can help you get noticed by the program. And that's exactly what you're trying to do with program signaling. Of course, the people that you know at the program could also tell you, you know what, our program director thinks program signaling is incredibly important, in which case you're probably going to signal that program. Now, we said earlier that you do not have to participate in program signaling, nor do programs. So some programs may not participate in that, and that means that you can express interest in that program in the more traditional ways. Now, why would applicants not use program signaling? Well, some applicants may not use it because they might not have decided where they want to be. Perhaps they're still figuring out what programs are a good fit, and maybe they haven't figured that out by the time the ERAS supplemental needs to be submitted, or maybe they want to kind of figure it out as they go along, and that includes exploring the program during virtual interview visits. Now remember, program signaling is just one part of the decision-making process. It's not everything, but it is an important part of it. And even if you don't signal a program, you can still receive interviews at those programs. Okay, so this brings us to the end of the part of our webinar today on program signaling. So I want to, at this point, Alyssa, take a moment to invite questions. There may be some questions that we've received along the way. Is there anything you want to share with me?
We don't currently have any questions at this time, but I did want to state that if you guys do have questions, please feel free to send them in at any time. You can do that using the anonymous question and answer that should be on your screen. And then typically what we do is at the end of each section, we'll get a chance to answer all of your questions. So please feel free. We're happy to answer any questions you may have, even if it's about other things. But I did also want to state that we do have a YouTube video, which is part of our podcast as well, that is about the supplemental ERAS application, and it is specifically about preference signaling. So I will send a link out to that to the group as well. So If you guys have any questions, please feel free, but I think that we can keep going at this moment, Dr. Desai.
Absolutely. So just feel free to shoot those questions over to us. We will have time at the end of our conversation here today, our discussion on program signaling and this next part, to field some of those questions. So please do send those in. So I'm going to move right into the next topic. And let me start the slideshow. Okay, so we are going to be talking about publishing, but we're going to be talking about something that doesn't get a lot of press, doesn't get a lot of attention. It's a type of scholarly activity. It's a type of writing that leads to publication, and it's called narrative medical writing. And it's another way to publish. So let's talk about what this is and what it means, how it's used, and how to do it. So what is it? So this is a way for you to reflect upon your experiences with patients and actually write about them. So all of you have had these rich experiences that have gotten you to this point, right? So you may be from the US, you may be from outside the US, but all of us have had these powerful patient care experiences that have meant things to us, that have shaped us into who we are today, that have made us into these professionals. And medical narrative writing is a way to think about those critically and to write about them. And why do we want to do this? There's a lot of reasons why we want to do this and the benefits this can have for us, but it allows us to share things with others. We can educate people, we can inform other healthcare professionals about our perspectives, about the important issues that are involved in medicine. And we can use these to create dialogue, to create discussion. And those discussions can lead to other endeavors, whether it's research endeavors or efforts to improve our patients' health, whether it's on an individual level or on a societal level. Now, we also know that medical narrative writing has many other benefits, and that includes being more aware of ourselves. So when we write and we think about what we're doing, we write about those things, we become more aware of our feelings, our emotions. We become more critical in the way that we think. And we look at the medical profession in different ways, and we gain valuable perspectives. So the history of medical narrative writing is quite rich in medical education. This is not something that's new. It's been around for a long time, but it has really taken a hold of medical education in the US over the last 20 years. The first curriculum in narrative medicine started at Columbia University in the College of Physicians and Surgeons in 2000. And since then, many other medical schools have adopted narrative medicine into their curricula. So all you have to do is do an internet search on medical narrative writing or narrative medicine and medical school. And you're going to see medical schools like University of Pennsylvania and Columbia, and where I work at the Baylor College of Medicine and USC and Temple. You're going to see that a lot of medical schools have this embedded in their curriculum. They actually sometimes have tracks where students can take a track and immerse themselves more deeply in medical narrative writing. And residency programs have begun to explore this as well. Now, keep in mind, those people that lead medical narrative writing in medical schools also are involved in residency education. So this is something that's talked about a lot at medical education meetings, and so is received very, very well. Residency programs also know that medical narrative writing helps trainees develop important skills like professionalism, interpersonal, and communication skills. Now, where can you get your medical narratives published? There are so many journals where you can publish these narratives. And you all have probably seen these before as you've read different journals. So if we look at JAMA, for example, there's a section there called A Piece of My Mind. And what the journal writes is that they accept submissions for consideration as an article or a piece for this section from physicians who share real life stories about the joys and challenges of practicing medicine in the modern era. And so some of our most prestigious journals have sections for medical narratives. And so this is one area where you could potentially write and publish your medical narrative, but it's not the only area. There's a lot of places where you can publish medical narratives, and it's not just the prestigious journals. You can also publish them online in different collections of work on the internet. Now, why should you consider doing this? Why do you want to publish your narrative writing? Because it's often easier to write. These pieces are smaller, so they don't necessarily require as much work as a heavy research piece. They're often easier to publish and faster to publish. We all know how long it can take our research work to be published in traditional journals. And as I said before, you can not only publish these in traditional journals, but also in online collections. Now, are they looked at by residency programs? As I said before, they are. They are valued by residency program directors and faculty. In fact, some of the people who write these narrative pieces in these prestigious journals are actually program directors and core faculty members in these residency programs. And some of these individuals, as I mentioned, are involved in narrative writing at their respective medical school or their residency program. Now, relatively few residency applicants write these pieces. So if you do write a piece, it's accepted for publication, it allows you to stand out. And it's a great topic for discussion at interviews, again, because it's something that's valued by faculty and it's not something that's commonplace. So now I want to tell you that you all have a story to tell. In fact, you have lots of stories to tell. How do I know that? Because I've talked to so many of you, and at MD2B Connect, we talk to so many students every year, and we get to know them very, very well. And we get to hear about all these amazing things and experiences you've been through all over the world. And I can tell you that we are routinely impressed by the things that you've done and the contributions that you've made, especially over the last few years. It's been quite amazing for us to hear about how you've persevered, how you've risen to the challenge, obstacles you faced, how you've really shown what you're made of and how far you've gone to give your patients the best possible care. So there are so many rich stories that we've heard of, and those stories deserve to be told. And they can be told if you consider and are open to medical narrative writing. So at this point, I want to present to you a way to publish your medical narrative writing. And to do that, I'm going to bring on board now Dr. Ryan Downey. So Ryan, do you want to take it from here?
Absolutely, yes. Thank you, Dr. Desai. One of the things that really brings me joy in working with the client work with here at MD2B Connect is learning about them and learning about their stories, learning all of the wonderful things that you have accomplished. And so while talking to Dr. Desai, we came up with an idea that these stories deserve to be told. We wanted to find a platform to allow you to tell your stories. And so we brainstormed a bit and came up with an idea for a contest that you can submit your story to. And if your story is accepted, then we will include it in a published volume with other similar stories. Now, the theme that we've settled on is, as Dr. Desai just said, tales of inspiration, tales of persistence, even tales that are cautionary, things that you learned mistakes that you don't want other people to make. We want to have these stories told from your perspective during the time of COVID, during the pandemic. Now, what are we talking about here? We're talking about stories, things that we've seen are stories of innovation, ways in which some of you have come up with new ways to protect your mental health or to protect the mental health of your colleagues and fight off burnout, which has been a major problem throughout the pandemic. We're talking about stories of sacrifice, where you have given up your free nights, your weekends to take over shifts because your colleagues were sick or because, frankly, they just needed you there. We've heard stories about adaptability, improvisation, people setting up a tent camp, a field hospital, to be able to triage all of the patients coming in, even when it's not their specialty, and just chipping in to help out. Helping with your community, supporting vaccination efforts, supporting vaccination education efforts. We've heard lots of stories that we feel really tell us a lot about the people that are telling us the story, and we feel like they should be told to a broader audience. And so this COVID Stories contest that we've set up allows you to submit a story about your experience during the time of the pandemic. It could involve while you were a student. It could involve practicing medicine in your home country. All the details for the contest are on a website that Alyssa will share in the chat. But we wanted to make sure that you were aware that, or we wanted to make it easy for you to get that first step in this journey of potentially gaining some practice in narrative writing. As Dr. Desai said, it's a full-blown discipline. You learn a lot about how to structure the interview along the way. You learn to think about patients holistically and think about their families as you try to build a narrative in their history. So while we started out thinking this is a great idea, a great opportunity for these folks to tell their stories, we also think there are some benefits for you if you do submit and if your story is accepted. One is, of course, you get to share your story. In principle, this volume, this edited volume, will be shareable throughout the world, so international audiences will be able to hear about your story. But you'll also get an opportunity to include this in your CV, as Dr. Desai said, also on your ERAS application, and that could be the trigger for a deeper conversation, say with an interviewer. And if you do it just right, it can be an opportunity for you to showcase your skills, your qualities, these passions that you have, and concrete evidence showing that you have them, because here is this story of what you did. Those kinds of conversations during the interview tend to stick in interviewers' minds. It'll make more of an impression. They will know, and it won't just be you're telling them that you have these skills and qualities. They will see the evidence if you get that opportunity to open the door and tell about that meaningful experience, if you will. So the information for this contest is on our website, and we welcome all of you to submit, no matter what point you are in your journey, whether you're doing rotations, doing editing, doing the admission services side. We invite you all to think about this, to think about submitting, and the process itself will be educational. It'll be an opportunity for you to learn a little bit more about yourself and how you can structure your narratives moving forward as a physician. And with that, I'll pass it back.
Yes, thank you so much, Ryan. So the impetus behind this COVID Stories project, this invitation to all of you to submit your powerful stories, is because you've all done some amazing things. And we want to let your voice be heard. We want to share these things with the world because they deserve to be shared. And obviously there's benefits to you that go beyond that, as Ryan mentioned. This is part of your development. Some of you may not have done this before, and it will require you to push yourselves outside of your boundary zones, your normal boundary zones. But it's going to be something that really helps you build some important skills, and it can have benefits for you throughout your career. And certainly in the short term, it allows you to communicate some very significant points about you, strengths about you to residency programs. And we are planning to publish this volume in September, before the residency applications can be downloaded by programs at the end of September. So this is an opportunity, if you submit something and it's accepted for inclusion in this volume, for you to be able to list it in your application. And again, that can go in the publication record, and it can spark interest among residency programs, and certainly can be a great topic for discussion at a residency interview. So we invite you to visit the link that Alyssa has sent and give that some thought. And if you do have any questions, there is a contact form and an email address that you can send your questions to. All right, so Ryan, unless there's anything else you want to add, we can turn it over to Alyssa and see if there's any questions. Before we turn it over to you, Alyssa, remember, for our attendees, you can ask any question. It doesn't have to be about program signaling or the COVID stories. It can be about any aspect of rotations, letters of recommendations, applying to residency, and what have you. So Ryan, anything else before we hand it over to Alyssa?
No, just I'm eager to hear more stories. I see a few people on the call right now whose stories I've heard a little bit about, and so I'm just expressing interest in hearing others from other callers.
Me too. Me too. I would love to hear some more stories. So Alyssa, you want to take it from us?
Yeah, absolutely. So in the meantime, we did get a couple questions. So I'm just going to go through them chronologically in the order that they came in. And we'll try to get through as many as possible before the end of the webinar. So the first question is it possible to do USCE all in the same geographic area, but still successfully apply broadly?
Yes, so that's a great question. So when we have conversations with applicants, we will often talk about the importance of being geographically flexible. Because when you do rotations in different locations, it shows programs that you are geographically flexible and you've spent time in different places. And that might indicate to them that you're not restricting yourself to any one area. But we also understand that not everybody can manage to do that for different reasons. And everybody's life situations needs to be respected, and you may mean that you have to rotate in a single location. But I can tell you many examples of people who have rotated in one location who've managed to attract the interest of programs in different geographic regions. And there are different ways to do that. So obviously today we've been talking about program signaling. So that's something that you can use to your advantage. And of course, when you do get an interview from some of those places on your signals, if you haven't rotated in that area, they may ask you at the time of interview, what specifically drew you to their program? Why did you send that signal? So you want to be ready to do that. And then of course, you want to utilize every other strategy that is at your disposal to signal that interest that goes beyond program signaling. So again, as we talked about before, if you have colleagues and friends who are current residents, if you have seniors who have graduated from a program and are alumni, anybody that you know that can help you attract interest of that program, get you closer to the leadership who makes the decisions, you want to exercise that. And those things are things that a lot of students have done effectively, even when they haven't been able to rotate outside of one geographic location.
All right. Thank you so much for answering that, Dr. Desai. So our next question is, how do we get involved in medical narrative writing? And I think that we offered one option, which would be the COVID Stories contest. But if you would like to elaborate on some other options about that.
Sure. So a great way to think about how you want to get involved is to read a lot of pieces that have been accepted for publication in the different journals. So as I mentioned before, there are a lot of journals. If you just do a simple internet search, you'll pull up all kinds of journals that publish these, and a lot of them are open access. So you can go ahead and take a look and read these pieces, and you'll get a feel for how they're written, what kind of subject matter is being addressed in those. And just like you would with a research project, like let's say you were doing a case report, one of the very useful piece of advice is before you write a case report, read some, case reports in different journals, get some idea of what they look like, how they're written. And obviously every journal is going to have their own differences, right? Their own specifications for narrative pieces, but that's a great place to start, is just to read as many as possible.
Okay, thank you for answering that, Dr. Desai. Our next question is, how many stories will be accepted for publication? So I think that, Ryan, you might be able to answer that question. I believe that's about the COVID Stories contest. I did want to reiterate that there is more information about the contest on the link that I'd sent previously, but Ryan, if you wanted to explain.
Sure. So the question could be asking something slightly different than what I'm about to answer. So I'll answer that second potential question next. But the first interpretation that I have is how many stories will be included in the published volume that we are going to have. And that depends on how many submissions we get and how many are of a high quality and that we feel capture some interesting, innovative, impressive, but mostly inspirational story that conveys what you accomplished during the time of COVID. And so we're aiming at somewhere between 100 and 150 at this time. But if we receive a lot more, then it could turn into a bigger volume. The second question was that I think the questioner might be asking is, how many stories could one person submit? And we're trying to encourage you to submit one story, the one that you think best captures everything you have to offer, this one sort of meaningful experience, so that we don't have too many submissions from too few people. But I would encourage you to submit any stories that you have, and we will make a determination later based on the number of submissions that we consider for inclusion, whether or not to include more than one publication from any particular author.
Okay. Thank you for answering that, Ryan. And then we have one final question. And like I said, guys, if you have any other questions, please feel free to ask them. This is time for us to answer anything that you may have, whatever it may be. So this last question that I have is step 3 more important now since step 1 has become pass-fail?
Okay, yeah, that's a great question. It is in the forefront of many people's minds right now. And so first, let's take a look at what we know about step 3 before step 1 went from numerical grading to pass-fail. So what we used to know about step 3 before that change occurred is that as a residency selection factor, it was one of the least important factors overall. You can see proof of that again from the NRMP match data documents, specifically the NRMP Program Director Survey. Now, the reason for that is that step 3 was something that relatively few applicants among the total applicant pool had taken and was available to programs. So obviously step 1, step 2 was more readily available and could be used more easily as a comparison tool between very different applicants, whether you're USMDs, USDOs, or IMGs. Now, before the shift in grading occurred, there were several groups of applicants that benefited from taking step 3 earlier. And for IMGs, that included applicants who had a history of low USMLE scores on step 1 and or step 2, and also applicants who were seeking to train with an H-1B visa. Now, what we're learning is how programs might use step 3 differently in this new era where step 1 has become pass-fail. And so we obviously don't have results from a cycle where this is uniformly in place, but we have some surveys of program directors that are starting to indicate that there may be more attention placed on the step 3 in coming years because step 1 is no longer available as a numerical grade. So that's what we know right now. We're obviously in this transition point, so we're hampered a bit by the newness of this whole thing. But still today, if you have a history of lower scores, it can be very, very helpful for your chances to take that exam and then pass it so that they are reassured that you won't have any difficulty with it in the future.
Okay, thank you for your answer for that, Dr. Desai. And we had one more question, or we just had another, so 2 more actually. So the next question is, does the contest require us to submit stories only from the COVID period or during any experiences we have? So I believe that the answer to that is only from the COVID period, but if you guys wanted to confirm that.
Yes, I confirm that. This initiative was primarily intended to thematically cluster the stories to the COVID experience. I don't want to discourage anyone from writing, but so if you want to explore this and practice your writing skills for an experience that was outside of the COVID pandemic, you certainly could explore publishing it somewhere else. For this contest, we're focused on, one of the criteria is it about something that happened during or because of the COVID pandemic?
And to add to that, it doesn't necessarily have to be a direct patient story, right? There's a lot of things that happened to COVID during COVID and affected us in different ways where, we did this or that, or we appreciated this or that, or we made note of this. And you may have done different things. So, like Ryan was saying, we've heard some, great examples of contributions people have made during COVID. And in some cases, it can be a reflection on how COVID affected your country or how COVID affected your family or your medical education. So even though we're saying COVID stories and we're kind of emphasizing the patient aspect of it, COVID as it affected medicine in different ways is something that we would be very open to hearing about from you. So I hope that helps put in perspective, what we would love to see. Now, obviously, there's many things outside of COVID that are rich for narrative medical writing, and there are many ways to get that out there. And that was something that you should definitely explore as well.
Yeah, and I also wanted to mention that there is a couple examples of prompt ideas for you on that link as well. So I would suggest if you would like to take a look at that, that may be helpful if you have any thoughts on that. So I will go ahead and go on to the next question. So our next question is, if I have a step 1 attempt, but then got an average score, is it better to take the step 3?
Yeah, so if you have a history of a step attempt, that would be the type of situation where taking the step 3 would be something that would be viewed very positively. Like taking the step 3 and showing that evidence that you have passed it is part of what can reassure programs that whatever happened in step 1 is not going to follow you along into residency. So that can be something that is a very positive part of enhancing your application.
Thank you for answering that. And then we just had one final question, and the question is what I believe they're trying to say is, does an old graduation consider one as a red flag?
Okay, so my personal feeling is that medicine is where, such an amazing profession, largely because of everything that the diverse people who are involved in the profession, people from all over the world, especially in America, with differing backgrounds, they are making what makes medicine so great. And so some of the residents and physicians that we have training in America today are people with rich backgrounds where their graduation dates are further in the past. And they are doing some amazing things in our training programs and as established physicians. They're making contributions to patient care. They're making differences with respect to research, like pushing research further along. They're making differences in teaching. So I believe that everyone should be judged on their individual situation, and that year of graduation should not be a factor. But we have evidence that programs do consider a year of graduation in making their interview decisions. So even though I might believe something, there are some different schools of thought. And you will see that, of course, and I'm sure you've seen that on websites. And that's not to say that websites that have YOG cutoffs would not consider people who have YOGs that are further in the past. I can tell you story after story of examples where people have not met the criteria for YOG, but have actually received interviews and matched into those programs. So a lot of programs that have YOG cutoffs are willing to make exceptions if, there is an application that's strong, that there's compelling things in them, just like for somebody who has a more recent YOG. Again, a strong application and a compelling experiences and activities and the way in which the application is written can help you overcome YOG criteria that even a program seems to indicate that it's very strict. Now, are there programs that are very rigid with their YOG requirements? Yes, there are some of those programs. Now, why do programs do that? Well, one of the concerns that some programs have is that because of your YOG and because of all that rich experience you've had, and a lot of people with older YOGs have been doing amazing things, right? They may be leaders in their departments back home in their country. They might be doing a lot of cutting edge research. But the concern from the program standpoint is, how will a person with that amount of experience work in a team environment where they have to take direction from someone who is much junior to them? And there have been some situations where there have been difficulties in those dynamics. And so programs have experienced that. And that's not to say that a young graduate, so to speak, wouldn't be someone who would have those problems. But that is one of the concerns that programs have. And so when you're creating your application, if you have a longer YOG, you want to include content in your application that shows that, that you are a team player, that you've worked with diverse healthcare professionals, people of varying experience levels, and that you can function as a leader when the situation calls for it, but you can also function as a team member that is open to the direction of those above you. So the take-home points, okay, if you have a longer YOG, is that there may be concerns that some programs have. You will see some criteria on these program websites which say this is our YOG cutoff. Some programs are rigid. Many programs are willing to make exceptions. So I want you to think about it in that light, and to put yourself in the best possible position to strengthen every aspect of your candidacy that you can, because I've seen amazing stories of people with longer YOGs that have made things happen. We've had at MD2B Connect several people with YOGs as long as 20, 22 years make some great things happen in the residency match. And that's what my hope is for you as well.
Thank you for answering that, Dr. Desai. So I think that is our final question for this webinar today. I just want to thank everybody so much for your time and for letting us answer your questions. I truly hope that this entire webinar was beneficial to you, and I hope that you're able to take something away from it. If you guys have any questions moving forward, please email me or let me know, and I'd be happy to answer your questions as best as I possibly can. I know that all of us here are a team, so you are able to contact Dan if you have any questions. I know that many of you are probably very close with Dan in terms of, you know, any issues that you may have and stuff like that. But you're always welcome to reach out to anyone on our team, and we're always here for you. So, and if you, Dr. Desai, want to wrap it up for the rest of us, that'd be great.
Yeah, so absolutely. So this has been a great webinar. I'm so happy that you all were able to attend. We talked about two very important things: program signaling, going to be a huge part of this year's application, and an opportunity to publish in a way that you perhaps haven't been giving a lot of thought to. But again, we are here at MD2B Connect, as Alyssa said, to support you in your journey. It is wonderful to have this opportunity to get to know all of you who are rotating in our program. I can tell you personally from my experience that I'm excited to hear about all these things that you've done, and I'm really excited about your future. And please do not hesitate. If you have questions, if there's something you want to run by us, you're not sure what to do, we are here for you. This is not just a rotation thing. This is something that we really strongly believe in, that you are part of our MD2B Connect family. So I don't want you to hesitate to reach out if you need something. So with that, I want to thank you again for attending. Ryan, you want to say a few words before we sign off?
No, I just thank everyone for attending, and I hope they've enjoyed it, and I look forward to the next one.
So everybody have a great night, and we'll all talk to you soon.
Have a great night, everybody. Thank you so much.